And we're talking about the coronavirus. This seemed to have taken every industry by storm.
So it's scary. People are scared. Everybody wants to know, is every cough or sniffle or sneeze a coronavirus? And I can't tell you as a doctor. We don't have enough tests. The state is restricting who can get testing, and so you pretty much got to be a celebrity or on your deathbed.
We're also getting CDC and government advice to not even really to travel at all at this point. And certainly it has impacted the world of Hollywood, film, television.
I mean, there are so many movies that were all set to open up, this spring. It is a scary thing where a lot of folks are holding back on the release dates of their movies.
As a country, we are a resilient country. We are a resilient people. But we're going to have to think differently. Our lifestyles will not be the same. The way that we do business will not be the same.
So if we have some of these different industries that are slowing production or closing, are we looking at a supply and demand or a supply chain shortage, if you will? Are we looking at a disruption somewhere in our supply chain at some time soon?
Absolutely. You look at the fundamentals of supply and demand. You cannot buy a product if the product's not on the shelf. And that's what happened with the grocery stores initially. So the normal process is you have a manufacturer. The manufacturer will get the product to a wholesaler or a distributor. The distributor will then get that product to the grocery store. But guess what? The increase in demand has just upset that apple cart, and that whole supply chain management piece has been disrupted, quite frankly. So we're going to be in Detroit and the Detroit area. Same thing here. The automotive plants are going to hurt right now because they're manufacturing their products. The challenge is, how do you get those manufactured products to the dealerships? And quite frankly, you can't get a car to a dealership if you don't have the parts to manufacture that vehicle. So the whole supply chain management process is being upset right now, which is why, if you noticed in the last few days, some of our auto companies here in Detroit are now offering 0% financing. They're basically saying, we're going to defer your payments, we're going to defer your financing, because they realize there's such a disruption right now, but yet they still want to somehow maintain a relationship with their existing customer base. But the bottom line is, yes, the supply chain management will be disrupted over the next several weeks, next several months, no question.
When we look at the numbers and the number of cases of those who have coronavirus, those are the numbers that are reported.
Yes.
But what about those who may have it and not know?
Right.
How are they tested? And is it based on whether you have good insurance or not? And it seems as if for you as a doctor, you have to face being both a physician and also an administrator on providing care based on whether they have healthcare insurance or not. And same goes for how we're treating and testing those who may or may not have it.
Right. Well, right now, testing is not based on health insurance because most, if not all, insurance have agreed to provide coronavirus testing and waive copays and deductibles, but we don't have enough tests. So we're rationing the test because we don't have enough. So you pretty much, all these celebrities who have no symptoms who are getting tested, I don't know how other than their wealth and their status. But everybody is scared that they have the coronavirus. And we are not testing enough people. And the main reason right now is because we don't have enough tests. But in so many other things in medicine, there are huge obstacles just to affordability.
You were talking about, how it's changing for you as far as how interviews are conducted now. Have you, in all your years of being a movie critic, a celebrity interviewer, have you ever witnessed anything like this before? Because it seems as if we're almost in unprecedented times.
Absolutely. I mean, I always say that in all my years on this earth, and there have been quite many years, I have lived through so many different things, but this has got to be the most bizarre time I've ever seen in my life. I mean, we think back to, of course, 9/11. That event affected everyone in this country, no matter what. And this one is truly affecting people because it's kind of like, we don't know, me, you know, whoever, you know, what's going on. And I've never seen it where people were afraid to leave their homes, afraid to go out and do things, or hoarding toilet paper, or, you know, other things like soap. My granddaughter and I were at a store the other day, and I took pictures of her standing next to these empty shelves. And it's like, it's unbelievable. I mean, because it was like this whole row of where toilet paper would be, everything's gone. This whole row of where bottled water would be, everything's gone. And, you know, it just makes you think, okay, you know, you can just still get enough to last you for a week. It's not like we said the zombie apocalypse is going to be coming out where you really can't leave your house or anything like that.
Well, thanks for reminding me, Greg, because I have to go grocery shopping later today.
How much toilet paper are you going to buy?
Not that much.
Okay.
I can only imagine the fears and anxiety that people have. You know, you're watching all these different industries, you know, change or close. Does consumer spending confidence factor into the equation here? Because it seems as if we were at one point riding a high when it comes to consumer spending. You know, the American people having some funds to be able to contribute to this economy, and now it seems as if companies and the consumer are holding back.
Absolutely. I think you're absolutely spot on. That's a great question. So if you think about what happened right before this situation happened, unemployment rate was relatively low. The cost of capital was fairly reasonable. Consumers had some money to spend, right? So the confidence, you're right, there's a direct correlation between having a job, earning money, and the consumer confidence. But now what's happening is consumer confidence is dropping. It's dropping significantly, and the unemployment rates will increase. In the last week alone, here in the state of Michigan, the number of unemployment claims jumped up 1,500%. In the last 7 days, our the number of unemployment claims totaled 55,000. Think about that for a second. So what we're saying there is, though people are not being paid, they're not going to be paid down the road. They're not going to have the money to spend. Their confidence is being shaken right now. So the first thing they're going to do is give me the unemployment check. Let me pay off my basic bills. If I can do that, if I can put some money in the bank, that will be great. But the bottom line is right now, the economy has been turned upside down. And from a consumer standpoint, our confidence has been shaken, and it's going to be shaken for a while. And there are projections that the unemployment rates will double, potentially triple, if this continues down the path that it's going. Again, if that's the case, less money in our pockets, less confidence in the economy. So therefore, I'm going to try to save as much as possible and spend less.
Social distancing has become this new term that's been coined. In the medicine world, has this term sort of always existed, or is it kind of being tool for?
We're hearing about it a lot more because of the
now,
coronavirus.
right?
Just because how serious it is and how we know that you can pass it and not have symptoms. There are certain illnesses that you can't pass until you're symptomatic. But the scary thing about the coronavirus is you can pass it to somebody when you have very mild symptoms that you might think are cold or allergies, or when you have no symptoms at all. So you might get coronavirus and live, but you might pass it on to somebody who isn't going to be as lucky as you. That's why it's so scary.
Yeah.
We are living in times where you look out into the streets or in our stores and empty shelves. It's almost like an apocalypse movie itself, right? that we're living in.
That's for sure. Remember the movie 28 Days Later that came out, I think about 18, 19 years ago? I was in London interviewing Danny Boyle, the writer-director of that film. And if you remember at the beginning, he shows shots of London where there's no one on the street. So I asked him, well, how did you do that? I mean, that would have cost you $1 billion just to shut down all those streets in London. Sure. So he told me what they did was they shot at like 5 or 6 a.m. on a Sunday morning, when normally, you know, there's no one out on the street, just to make it look that vacant. Well, the other day, true enough, I live in a residential area, but I went out and walked to the corner and you see no action. You see no moving. So I took video, you know, just like going, wow, this is kind of like, Danny's movie where no one's out, no one's doing anything. It's quiet. Even with the squirrels who live all over my house or, my neighborhood or backyard, they're not even out. They even got the message.
And we're also watching how local, state, and federal government is trying to respond to this, and perhaps with another stimulus to give money to companies such as the airline companies that have been hit, and also to the everyday American. We're hearing stimulus checks that may be coming. How do governments respond financially or economically to this situation, and where do we go from here?
I think the government response to stimulus check, quite frankly, $1,200 doesn't go a long way. And if anything, I think what they're trying to do is to portray it as a confidence booster that basically says, hey, we got your back. We know that you're hurting right now. And which is it's a good move to get something in people's pockets, because if you get something in people's pockets psychologically, they're going to feel better about that. But I think in terms of what the government should be doing, I don't know. I'm not an economist. I don't run the Treasury for the U.S. But they've got to find something that's ongoing. See, the stimulus check. You know what I'm saying? It's a one-time hit. That's it. What happens when that $1,200 is gone? Right? We're back in the same position. Here's some things I think the government should do if they can do it. They need to work with the state and the state and local governments and do what New York just did. New York is now waiving 90 days, 3 months of mortgage payments. Go ahead and waive rents. They should encourage the landlords, okay? Somehow encourage landlords to waive the rent payments right now for 2 to 3 months. If you're a manufacturing organization here in Detroit, for example, the federal government should work with the big three. They should work with the autos and say, hey, we're encouraging you to waive payments for up to 3 months. So while the stimulus package of $1,200, that's a one-time hit, the plans that I'm laying out for you go beyond that 1, 2, 3 month period. Okay, so that it goes beyond that 1 month of getting that $1,200, that one-time hit. So you want to try to increase the consumer's confidence over time by focusing on things that direct their lifestyles on a daily basis. So your rent, your mortgage, your car payments, other things that affect us. The utility companies. The government should work with the utility companies to say, look, we're going to give you some tax breaks or abatements that basically say, again, don't punish the consumers for not paying on time. Just eliminate all those fees, quite frankly. And I think that would go a long ways to help you to get that confidence back in a very trying situation.
If this is a temporary phase that we're living through, and we look back at this new reality that we had lived through, how do you vision, from just a medical perspective, this time we're living through and how it's impacting almost every industry? I don't think we've seen it to anything of this magnitude before. We
haven't, and I'm happy to be talking to you today, but it's stressful to think about as a small business owner. People can't get out and utilize my services. So what's going to happen to me as a small business owner? I have to think about what's going to happen to me as a mother. I have 2 kids. Unfortunately, we don't think that the coronavirus, at least from other countries, has been as fatal as children, because it hasn't for adults. But as a healthcare worker, am I going to bring it home to my children? My sister's a nurse. So even if I decided, you know what, I'm not going to practice anymore, which I wouldn't because I love what I do. But then it's like, okay, even if I just stayed home and isolated myself from patients, and what, am I never going to see my sister or her family again? So it's just a stressful thing. I do believe it's temporary, and that it's gonna last longer than a couple months, is my personal belief. And part of the problem is we are not isolating ourselves enough. But then again, we go back to the fact that some people can't. Just on social media all day long, Dr. Dooley, I want to stay home, but I will have no money and then you have people in the government arguing about who should get a check and limiting it to not realistic amounts. So it's just a tough situation all over. Do I think that there's ultimately going to be a light at the end of the tunnel? and we'll get back to somewhat like normal. I think we will, but just like when the vaccine comes out, I think people are going to be lined up to get the vaccine, which is a great thing. But the flu virus, enough people don't get the flu vaccine. So I hope that people realize that, hey, not only am I going to get the coronavirus vaccine, but I'm going to get every vaccine out there for every virus, because there's no point for anybody to needlessly die from a vaccine preventable illness.
Let's talk about what Netflix is doing. They decided that they were going to create a fund of $100 million to help the creative community in Hollywood, and mostly being able to first help majority of its cast and crew on their Netflix productions. Even that, I mean, is unprecedented as well, because, on sets like Netflix or any production, you have, the trickle down employment, such as electricians and carpenters and drivers who mostly work hourly. What's your thoughts about that? And you recently had work scheduled with Netflix, and even that's been canceled.
Right. Well, Netflix it's a good company. The people who I work with there are just excellent. They love taking care of people. They love doing things, it seems, above and beyond, for folks. And I think it is a good idea, because you've got these folks, like you said, who are going to be working for you and doing things. And, now is not the time for anyone to be selfish, like, oh, well, you're not doing anything, well, we don't need to pay you. Well, that's not how, we as people should be. We should all be out there trying to help each other. So I think that's great, where they want to make sure that, because people, they've got mortgages, they've got rent, they've got car payments, they've got, so many other things, insurance and all like that they've got to pay for. And if they can't make the payments, then they'll lose things, or, be at risk of, if something happens, they don't have that umbrella anymore. So yeah, congratulations to them at Netflix for wanting to do this, for the employees and the people who are working through them.
I guess in times like these, it's an interesting time to perhaps be a creative or an innovator or entrepreneur. How do you try to move on while people are depending on perhaps a check? You could be at this point starting a business that people, creating a product that people need.
And you hit the nail on the head. Be creative. Now is a wonderful time if you want to start a business. Think about this for a second. It's a great way to start a business online. And if you start a business online, for example, your costs are actually cheaper, right? Your infrastructural costs are actually cheaper to start a business online than it is to start a brick and mortar. And so what happens is that a lot of entrepreneurs have tried to start businesses in a traditional sense using brick and mortar. You got to pay rent, or you got to pay for the building. You got to pay for the overhead. But now you have the opportunity of still engaging with consumers, but you have to think in terms of being innovative. Okay, I can't see Andre Ash right now. I can't see him face to face in terms of being in the same presence with you, but I can talk to you through video technology. So why not start a business using technology as your platform, and then you build your platform to meet specific consumer needs that they may have. So, but again, we've been conditioned and we've been taught to think traditionally that I have to do X, right, in terms of starting a business. But now I'm encouraging people to say, do Y, be creative, use technology and use other means that we have out there at our disposal. And quite frankly, don't sit back feeling sorry for yourself. You have to be aggressive. You have to think forward. Don't think in the past, learn from the past, but use those educational learnings and focus on building for the future from a business standpoint.
It seems as if this coronavirus is changed our perspectives about many things. Telemedicine, how do we engage with our physicians more while being at home, instead of making that trip to the hospital, to the family doctor office? Where do we go here when it comes to treating the patient while at home with the technology that is available?
Well, I feel like if there's any time to have a pandemic, it's better that we have it now than when I was a child and I didn't have the internet. So I think that we need to move to pretty much all telemedicine at this point, it's my personal belief, not only to protect doctors, but to protect patients and protect my staff, my medical assistant, my receptionist, to protect us all. We need to move to telemedicine. And I was just reading that Medicare just, you've heard of HIPAA, right? And the privacy laws. And so usually you're supposed to communicate with your doctor through a HIPAA compliant website or app, which FaceTime and things like that aren't, but they've waived that restriction now. So that's really exciting. So you should be able to talk to your doctor via FaceTime, or if they have a HIPAA compliant app, you can use that, but not all doctors do. Most large health institutions have some way for you to do that. I'm affiliated with Ascension, St. John Providence, and there's a way to do that. So we definitely, if at all possible, should move to telemedicine. It's the field of medicine is one that's such that, can we do it 100% remotely? No. There are some things that I just have to touch you, I just have to feel myself in person. But right now, there's really no reason to get things that can wait. Health institutes have stopped doing things like mammograms and preventative things right now because our focus has shifted. But absolutely, if there's a way for you to communicate with your doctor remotely, that is what we need to be doing at this time.
We talked about film, movie theaters, and streaming services, and how this coronavirus is really impacting all of those industries. But let's also talk about the TV industry, the TV landscape a bit here, because we're seeing the landscape of television shows and how viewers see them starting to change, or some of these shows even being canceled. Morning television shows, like the Today Show, you have the anchors who are doing the weather or news from home. I mean, have you seen anything like this before? It really changes how viewers watch television nowadays as well.
It really is, because like the way it's going right now, all of my friends who do the same thing I do, the movie scene where we go across the country and do the interviews, they're all doing their stuff now from home. You actually get to see what everybody's house looks like. I mean, like right now, like I said, I'm actually in my basement, and this has been my studio for the past week. And it is just strange where it's kind of like when I say non-essential people, aren't even allowed in the stations anymore. It's kind of like, okay, you've got to be, either like the lead anchor or whatever to go in and actually do the news. But then again, the other night I was watching on a national channel, Anderson Cooper, and he was even doing stuff from his house, not even going out. So yeah, it's just so bizarre, but thank goodness we've got things set up, just like with what you and I are doing, where we're still able to do these interviews and being able to, talk to the people out there. So that's pretty good. And then something else I wanted to mention, just when you were talking about, effects on movie theaters, a friend of mine and I started about a week ago. Like you said, movie theaters are now closed down, across the country, where people can't even go in. And, a lot of folks will say, oh, well, they're rich anyway. Well, they're not that rich to be shut down. They need, people to come in. So we started this thing where we went online, putting up this thing about go to your local movie theater, buy, say, like a $25 gift certificate or a gift card, where you can use it, once everything's over, you'll be going back to the movie theater. But at least that way you can help, get some money moving in there so that the movie theater chain or whatever it is isn't just shut down. But again, we've got to do that, with all types of businesses. Go to your corner grocery store, go to your corner gas station or whatever, buy different things, because if the money's not there, they'll close down, and then you won't have, certain places to go.
As it relates to this coronavirus, I mean, in some ways, it looks at it seems as if what we're seeing in some ways is unprecedented, because the NBA season having to be delayed. Right now, we're living through what will be the mid-heart of NCAA March Madness. Completely, that season has been completely closed off. Have you ever seen anything like this before?
Well, no, I can honestly say I've lived through, in my lifetime, I've lived through several major situations, right? Even predating 9/11. I can tell you, I remember the day, for example, that Dr. King got assassinated. As clear as I'm looking at you, I remember the day that he got assassinated. I remember the uprising of six. I lived through the 1967 uprising in Detroit. I've written about it in other media platforms. I've talked about it on local TV and other things. I've lived through that. The city of Detroit shut down in those days, right? And other cities like in Newark, New Jersey, and in Los Angeles. So those cities got affected. But on a national level, the closest thing that's come to this has been 9/11. When 9/11, when we lost all those individuals, it's certainly because of the terrorist acts. But that lasted for a while. Don't get me wrong. The difference with this one is no one's. Well, I'm not going to say that. The difference is we don't have a cure for it. It continues to grow. It continues to evolve, and quite frankly, no one knows how to stop it. And also, the difference is that this is a global issue. It's global. Think about 9/11. 9/11 hit pretty much the U.S., right? It hit New York, and it hit primarily our domestic sites, if you will. This epidemic, for lack of a better word, is global. It's literally shutting down countries. It has shut down Italy. It has shut down Spain. As of this morning, 75 million people in the United States are now locked down. They're in their homes for the next 30 days. So I have never, to answer your question, seen anything like this, ever.
And it has a great impact on businesses as well.
It's got a huge impact on business. And I think what people need to realize is I'm not sure that we're going to come back the way that we came back before. This is going to take, and what I mean by that is, as a country, we are a resilient country. We are a resilient people, but we're going to have to think differently. Our lifestyles will not be the same. The way that we do business will not be the same. Universities will not be the same. I was reading an analysis. I also I'm an adjunct professor. Think about this for a second. Some universities may not rebound from this situation. Would you ever send your young one to a college or a university and put them in a dormitory right now? Think about that. If you're a parent, as a parent, are you comfortable enough to do that? Now, and so the business model from a university standpoint is going to continue to change. I mean, we have shifted all of our classes, as all universities have, from in the classroom to online delivery. That begs the question, do you need the more traditional university structure down the road? Right? So all that's been discussed, and what I'm sharing with you, these are analyses and articles that are discussing these issues. So my point is, on a go-forward basis, I'm not sure as we come out of this, and we're going to come out of this, but when we do come out of it, I'm not convinced that we're going to come out of it the way that we were before we went into it. And we're going to come out our thought processes are going to be different. The way that we do business is going to be different. The way that we consume products will be different. So our lives across the U.S. and the globe will be forever changed.
Mark S. Lee, thank you so much for talking to me. I really do appreciate it. Founder, President, CEO of the Lee Group. Thanks so much for sharing your time with us. We really do appreciate it.
I'll talk to you soon. I appreciate it. Thank you.
How do you balance caring for your patients and then the realities of being really handling a business and then also caring for your family in this time?
Yeah, I mean, it's tough. You just fight through it. I went into this field. I always knew I wanted to be a doctor from the time I was a little girl. I don't know why. I don't have any magical story about why I wanted to become a doctor. And I really couldn't imagine myself doing anything else. And I honestly feel that it's because I've read that children are less likely to get fatal forms. That's keeping me going. If I felt that I was putting my children in a lot more danger, I mean, they're in danger of the fact that I'm a healthcare provider, but in a lot more danger, I don't know if I could do it. Because they're not giving us masks. And just when you think about in this country, how do we get to the point as the United States, one of the wealthiest countries in the world, right? Well, we don't have enough masks. Where other countries where they have national health care, where they have a universal healthcare system, they're giving us masks. I thought we're number one. I thought we're so great. And then we have something like this and we don't make our masks in this country to protect our healthcare workers. I mean, think about it. If doctors and nurses disproportionately get affected with the illness, then who's going to be left to take care of everyone else? So just the total disregard for life in general, but for healthcare providers is just so frustrating. I was told we will not get masks unless we work in the hospital. I only work in my office. But before you end up on your deathbed and in the hospital with coronavirus, you're going to have some mild symptoms. There's going to be you don't just wake up one morning and feel like you're going to die and go to the ER. So who's going to see you first? It's going to be people like me. So we're on the front line too. But it's just frustrating that in this country we didn't think that something like this would happen and prepare for it, because this has not been the first pandemic ever and it won't be the last. And it's just frustrating that we did not prepare better as a nation to protect everyone, but specifically to protect our healthcare workers.
Greg Russell, it's been great having you give us your perspective and how this has really changed the game for Hollywood in both film and television.
Well, thank you so much. It was a pleasure being here and great talking with you. And like you said, these are just strange and different times. And will it affect the way we live for a while? I'm quite sure. But like you said, I look forward to getting back to the days where you see an old friend, you can give him or her a hug, and people will be close together. But I know that's definitely going to take some time.
Absolutely. Greg, thanks so much. We appreciate it.
Thank you.
Does it make you angry or sad that in some ways it almost feels like you're kind of almost being forgotten when it comes to, in particular, fighting an infectious disease like this? Because certainly we rely on our personal healthcare physicians before we have to go to the ER. We're in touch with them on a regular basis. Do you feel like you're kind of being left out? Does it make you sad or angry that we're not as prepared as we should be?
It makes me a little bit of both. I try not to live in a state of anger. That's not healthy. So I'd say it makes me mostly sad that because of capitalism and just incompetence that we didn't better prepare as a nation. So it makes me more frustrated. I feel like there's plenty of people who appreciate us and what we're doing. But yeah, it's very frustrating that I can't get something as simple as the proper mask as a physician to take care of myself. The fact that people are reusing masks that aren't supposed to be reused. The fact that you have to be a creative sewer to sew up your own mask. It's just a situation that, if anything, we should have had masks and the equipment for doctors and nurses. It sounds like something that's a small thing, but it's a huge thing. It could be the difference between life and death for us. Again, we're going home to our families. We need to be protected just like anybody else, but we're a lot more at risk. We're closer, more in your face, so we're a lot more likely to be at risk. So it makes me frustrated, and it makes me feel like maybe we aren't, as a healthcare profession, valued as much as I thought we were. Yeah, so that's frustrating.
And then just finally, I mean, certainly there are, the advice that you would give your patients, but during this time, as a physician, as a doctor, what do you go back home and tell your family and the practices and how this is changing your own household?
If at all possible, stay at home. And it frustrates me that I have to say, if at all possible. If we had a functional society and a competent government, we would make sure that everybody could stay home. It wouldn't be if at all possible. It'd be the government is going to make sure that everybody can stay home and has the money to do so. So stay at home. If you feel sick, isolate yourself if it's as much as possible. But at the end of the day, unless we shut everything down, it's going to be tough. You can't go to the restaurant, eat in the restaurant, which is good, but somebody can bring takeout to you. And that person who's bringing you takeout is exchanging credit cards and hands with a ton of people. And yes, they might be using hand sanitizer in between, but I think that we can do better. And I would just like to urge people to think about that we do deserve as a society, just on the basis of being a human being, that we deserve universal health care. We deserve to not die from illnesses that are too expensive for us to treat, and realize that that's how they do it. In every other developed nation in the world, you have health care as a human right. So I hope it encourages some people who weren't on board with the universal healthcare system to acknowledge that how maybe this could be a little bit better if we did.
Well, Dr. Dooley, thank you so much for your time, and we're hoping that this is a temporary new reality for all of us.
Yes, thank you.
Absolutely.
Elbow bump.
Yeah, elbow bump. Social distancing.
Right.
Right. Thank you very much.
Thank you.